Well, thank you all for coming, and we're really happy to have Dr. Tomayko here and see, at least I feel like some new faces for me, so yay and welcome, and some people I don't see all the time. So Dr. Tomayko is an assistant professor in the Department of Food Systems, Nutrition and Kinesiology here at MSU. She has degrees from University of Georgia and University of Illinois, and her research focuses on understanding and addressing childhood obesity disparities and promoting health across the lifespan, particularly among rural and Native American populations. She also found a really cool thing with the PowerPoint, which is exciting, and just is more exciting than we usually see with PowerPoints. So that's awesome. So I'm just going to read a little bit more about her work. She investigates how structural factors such as 4-day school weeks affect the health and well-being of rural children, families, and communities. In partnership with the Confederated Tribes of Warm Springs, Dr. Tomayko co-develops culturally grounded health resources, including a youth-focused traditional foods toolkit, and is a long-standing member of the team studying development and dissemination of Turtle Island tales. That sounds super cool. It's an evidence-based obesity prevention intervention for Native American families and with young children. So I'm super excited to hear more about you and your work, and let's welcome.
Well, thank you very much. I know you said some of the faces were new to you, but they're friendly to me, so I appreciate seeing you all here, and hello to those online. And this probably set the bar a little high because nothing else is really cool after this. I don't have any more fun animations or videos. Totally stumbled on this by accident, but it is a little bit mesmerizing. So yeah, I'll be talking about a couple of those projects today. Thank you for that introduction. And I had to laugh a little bit when I was looking at the past speakers at this seminar series, and I know you've had other topics, but in terms of ecology and looking at, grizzly bears and wolves and amoebas and all these really cool things that people in your area are studying, and how this could possibly fit in may seem like a bit of a head scratcher, but actually the work that I do, I frame in the socio-ecological model. So it's ecology in a different frame, but that's really how I think about my work. So I just want to introduce that concept a little bit up front. All of my work really focuses on children and child health. So we think about the child in these nested spheres of influence. So we know there's factors at the individual level that are going to impact child health. Do you know how far I can wander? This does feel hard to stand here, doesn't it? I'll try my best. That are going to impact child health. Some of these factors we can modify, some we can't. Things like genetics, we're not really able to modify those particularly. But some of these other factors, health behaviors, we can certainly have an impact there. But children are existing within a family. This might look different for every child, but there's lots of factors at the family level that we know are going to impact child health. Things like the family home environment, what's available to children, what's their household structure. This is something I think a lot about with our 4-day school week work. Food security, do they have access to food? And then these child and family units are exercising health behaviors across a variety of settings, things like childcare, where children might be spending a lot of their time, particularly interested in schools and community settings, how resources there might be impacting children and their families. But there's also these other maybe broader spheres of influence, things like land use, maybe things that you all think about a little bit more. Do you have access to a safe place to play? What are the food systems and how do those feed into what you have access to? And then even on top of that are just some of these more abstract or conceptual factors like the culture, the norms, the values of a particular unit within the socio-ecological model. And we know these change over time. Most of my work is with children, young children, but these factors change as children develop. And we also know that policies have a big impact across this as well. So this is how I think about a lot of my work. I'm hoping to talk to you today about two different projects. I'm realizing, is that clock? The clock isn't right, is it? No, I need to keep an eye on time because I will go. Okay. I'm like, I've already gone in. So just a little bit about who I am. This is just a word cloud from some of my recent publications, just to give a quick sense of the things that are important to me in the work that I do. And I'm hoping to talk to you today about two of the projects that you mentioned. So the first is really around Turtle Island Tales, and this is a really long-term partnership on health promotion with multiple Native communities across the country. And then also a project looking at impacts of reduced school exposure via 4-day school weeks, which is a really Montana relevant topic. And what these really have in common is just that focusing on that critical period of childhood. We know that's really important for just development of health behaviors and things that will contribute to their long-term health outcomes. So that's really what links these projects. So just briefly, how I ended up here. I did my doctoral work at University of Illinois. We were studying diet and lifestyle interventions for chronic kidney disease patients. I don't know if anyone's ever known anyone on dialysis. Is that familiar to you? It's a pretty clinically complicated population. Even with lifestyle interventions, the quality of life was quite low. So I knew I really wanted to work on prevention in earlier life efforts. Which led me to my postdoc at University of Wisconsin. But in between that time, I did my dietetic internship at University of Houston. So I'm also a registered dietitian. And I also did a policy fellowship at the National Academies. I continue to be interested in the intersection or how policy really impacts across all of those levels. And what I learned from that experience was really that I wanted to be generating the evidence to inform some of those policy decisions. So I did a postdoc at University of Wisconsin with Alex Adams, who many or most of you may know. She's the director of the Center for American Indian and Rural Health Excellence here at MSU. The time she was at Wisconsin, and I'll leave the rest of that blank because I'll fill that in later. But our work, and I'll kind of start there, what we have been working on for the past close to 15 years now, is this family wellness program called Turtle Island Tales. So really how we frame this work is thinking about health in Native communities, really relying on and understanding and respecting their community strengths, things like robust social networks, connected food systems, this really deep understanding of the connection between humans and the food systems and planetary health. This idea of passing knowledge from one generation to the next is something that we work to embed in our program. And really just this idea that wellness is not just physical. So my background's nutrition, but what you eat is just one small part of that. There's all these other factors. But we know on the other side of that balance, there's many, many challenges that these communities are facing. High levels of obesity and other chronic diseases, significant poverty, reduced healthcare access. This is also something that's present for many of our rural communities, and that also relates to lower food access, so food security being an issue. So this program, and I'll tell you a little bit more about that, was developed to address a gap in home-based wellness programs for Native American families with young children. And how it works is it's a 12-lesson program. And so it was originally designed as a year-long intervention. Every month, families would receive a packet, and each packet contained a printed booklet, a children's book on the topic, multiple support items, and then recipes and other handouts. Below are some of the titles and topics. So it had your more traditional wellness targets like nutrition. There's a vegetable lesson, there's a fruit lesson, healthy snacking. Physical activity was part of that, also screen time, but some other targets too, like traditional practices and family traditions was a lesson in there. Sleep was something that we felt was really important to include. Based on some learnings from early work with this program, where we learned that these young children were staying up really late at night and understanding how that contributes to obesity risk. So every month they would get a lesson targeting one of these topics with all of those items. And these are some of the important features. So taking a holistic approach. So it's not just physical wellness, but trying to incorporate other aspects of wellness. It is story and character based, and I brought along Igmu today. Some of you might know Igmu, but this is, we actually call this one Big Moo. He is a character that is throughout all of the lesson materials. And one of the cool things about Igmu is that it really, kids get really excited about the character. I mean, food companies use characters all the time to market cereal and other less nourishing foods. So we wanted to utilize that too. So Igmu is the Lakota word for cat. And I have to be careful when I present with him because I often will like forget I'm holding him, and someone took a picture of me presenting and I'm cradling Big Moo here, but he's comforting and he's familiar, and kids really relate to that. So that was an important piece of the program. He's also featured in the videos, which I won't have time to show, but we have videos on the website that are pretty cool. So as I mentioned, it was designed to be used in home. Yes. Well, it is a bobcat. And it actually had nothing to do with MS. There's a whole story behind that too. We have other characters in development. Next is a raccoon, but yes, for right now, we have Igmu the bobcat. So the program was designed to be used in the home, really, because there was this lack of home-based intervention. So it was mailed directly into homes. And we worked for many, many years with lots of different communities and partners to make sure that it was rooted in Native culture in a way that was relevant enough, but broad enough that multiple communities could see themselves in this program. So this is just a sample lesson, what one would look like. So it comes in these bubble mailers and has all sorts of goodies in there. Actually, each participating family gets a little Igmu puppet. I wish we could send the big ones, but they actually don't make those anymore. So we've been buying them off eBay. So this is just kind of a timeline of the project. The first two, so it was formerly called Healthy Children, Strong Families, and it underwent testing through 2 large 5-year trials. The first one was with 4 communities in Wisconsin. That informed the inclusion of the sleep lesson, for example, and some lessons on emotional regulation based on what we found in that first study. The second trial, Healthy Children, Strong Families, which is about right where I came into the project, was with 450 families across 5 tribes, more geographically dispersed. And then we underwent a period of program adaptation. And that was actually when Igmu was developed. It used to be very clip art looking. The content was great. We generated positive evidence for health behavior change from those trials. Families liked it, communities liked it, but we realized we needed to incorporate some elements to make it easier to more broadly disseminate. So a lot of changes were made. The name was changed. Turtle Island is the name many communities use for North America. And so a lot of changes and improvements were made. We tested those materials with Blackfeet community. And then we are now in the phase of, oh, I did have a graphic. That's the only other one, I'm pretty sure. So then what we realized is that we had this great program, we had the evidence base for it, but we weren't really sure how to get it to the communities who wanted it. And I think this rings true for a lot of people. They spend a lot of time really developing and testing a program. A lot of work, a lot of community input went into this. So we partnered with some implementation scientists from the University of Utah to really think about how do we systematically deliver and implement this program with communities. So part of that was partnering with some of these organizations here, some of which have been receiving a lot of attention. Actually, SNAP Ed was eliminated at the beginning of last month. I'll talk a little bit more about that. But really the whole goal of this current phase of our work is trying to understand how to get this to communities in a way that makes sense. So really where we are is moving toward the right side of this figure. That took me a minute. So we worked a lot on the intervention, development, and testing, trying to develop it in a way that communities would find useful. And now we're in the phase of getting it out into the community. And it has been a wild ride, I will say. We are currently with 7 communities. I'll explain a little bit more about that later. It's actually a lot more sites than that. We had intended to work with 4 just to understand, take a deeper dive into how our communities wanting to engage with this program. What are ways that we can do this in a sustainable way outside of a grant so that communities could have access to this program for the long term. Really like this figure too. So this, I don't know if you've seen this before or something similar, but this statistic gets cited quite a bit, and I don't know if it's actually still true, but that it takes a really long time to get that evidence-based thing actually into practice. So the program, the clinical application, the 17 years was cited for a really long time. And not only that long time from getting it into broader use, but that's a really small amount of evidence-based things that actually get into implementation. So that's where the field of implementation science is really focused. How do we, and I think by and large, those numbers have improved because of this, this field of research that is focused explicitly on getting evidence-based things. I'll explain a little bit more about that into practice. So I've seen this, it's kind of catchy, but people will call it, you know, the P's. So it could be, in our case, the program. These are all the possible evidence-based things. A pill, so a drug, maybe that's been tested. You know, there's still that long timeline to get that into clinical practice. It could be a policy, a principle. So you have this evidence-based intervention. We're assuming there's enough evidence to implement it more broadly. So like those 2 trials I showed you in our case for Turtle Island Tales, it is something that needs to be evaluated, how it's being implemented, how what the uptake is like, what's happening to the intervention. Is it being delivered with fidelity the same way that you intended? And really that context matters. Once you get out into the real world, it's a lot messier. I think this is maybe less of an issue for those of us who do community-based work because it's always a little bit messy, maybe than like a tightly controlled clinical trial of a drug, for example. But things change quite a bit once you get out into communities, clinics, wherever you're trying to apply this thing. So this is our current phase of the project, and it's in partnership with the University of Utah. They bring a lot of that implementation science expertise, which has been wonderful. And really utilizing this implementation science framework. This is an outcome framework that helps us understand how we're doing with implementation. So we use REAIM, and this is how we organized this current project, where really our primary outcome for this work is to increase the reach of this program. So it's just pretty simply just a count how many children, how many families, how many communities are we able to reach through this. We're also interested in, is the program still effective? Are we still seeing health behavior change when it's delivered in these community settings? And then we have other outcomes related to the other components of REAIM. So adoption, this really looks at how a group or community decides to use the program, how it might spread, how are they actually implementing the program? What does that look like? Does it increase the effectiveness? Does it decrease that? And then maintenance. This is a really big one. How can we sustain this over time? This has long been an issue with intervention work, is that once the grant money is gone, then what do you do? So that's been a really big focus. We're also interested in how this program might support food security and looking at the cost of this relative to other health education programs, because it is a bit expensive on the at face value. So bringing back the socio-ecological model, this is just really specific to this particular project. So the things that I want to call out here are those organizational level factors that we were really interested in. Who can we partner with? Who are going to be our community champions to really bring this to families and communities who might be interested to participate. At the community level, there's lots of factors in Native American communities that we wanted to acknowledge and include and support. And at a systems level, so SNAP-Ed, which again is no longer in existence, and that's been a really interesting shift. But at the time, this was our big focus, knowing that the charge of that program, so at the time, was really delivering nutrition education to SNAP-eligible families, directly aligned with what we were trying to do. So we were able to get our program accepted into their repository so they could use their federal funding to provide this program to communities. Most SNAP-Ed programs were administered through state cooperative extension, and thankfully some of those structures remain intact even now. So we're just figuring out how that looks in terms of program delivery. But working at a state level has been really interesting. We're working in 4 states currently and trying to understand how funding decisions are made for programs, like which communities get served and those types of things. So part of why we were challenged to get this program out to people is understanding really how to scale up an intervention. I don't know if anyone else has experience with this, but it just brought forth a lot of challenges we weren't anticipating, a lot of supply chain, inventory management, things that I was not trained to do. And this is actually my office in the health sciences building. It's kind of fun when this is not the worst it's been too. Sometimes the boxes get stacked up completely around my desk and I have to kind of navigate my way back there. And I'll tell you a little bit more later about how many families we have currently, but it's a massive undertaking to order, organize, compile kits, coordinate sending them out. So this is a little bit how this is looking right now. And one of the really important adaptations that we made was in thinking about who our community partners could be. We switched from a model of having families select into this program to receive it to working with classrooms. This has been a really interesting switch. So identifying a partner either through cooperative extension or Head Start, often both, where they'd select 1 classroom, 2 classrooms, depending on funding. And every child in that classroom receives the program in their cubby or backpack. And then it goes into the home. So it's still intended to be a home-based program. We were trying to reduce burden on communities to recruit families or find families, and also to make it more equitable for children to participate. They were able to opt out if they wanted to. And so far, out of hundreds of children in this wave, we've only had 1 person even ask about it, and they were just curious what that meant. So far, no one's opted out, but it's really reduced a lot of the burden on the community to find families who might be interested to participate. But what that has done actually is in working with Head Start, and we initially envisioned they were somewhat of a, I don't really want to say passive recruitment partner, but just they were allowing us into their classroom to provide the program to children in their classroom, but they became interested in the program and they wanted to know what it was and they wanted a kit. So every teacher started getting one of the monthly kits so they could see what their students were receiving. And so we shifted from where we initially tested it, which was home delivery, to home through the classroom, so still getting into the home. To then home plus classroom, where the teachers were like, oh, I'm going to read the book to the kids at circle time, or I'm going to do this activity. And then where we're spending a lot of our time right now is this classroom only component. So as funding has changed, as we've had this enormous disruption with SNAP-Ed funding being completely eliminated, we're really interested in exploring this as a more cost-effective way to reach more children. However, we don't really know much about effectiveness in the classroom setting. It wasn't designed that way, but it certainly seems to be of interest to our partners and something that a lot of them have really taken on. So this was actually from a kindergarten classroom in Blackfeet that we visited just last week, or 2 weeks last week. This is actually amazing. We had nothing to do with this. She was just receiving the materials and she created what will be a monthly display of the kids' work. So it's got all of the the coloring sheets that come each month. She'll plan to replace those, or some of the activities. There's, you can see little baby Igmu puppet in the photo there that was helping the kids make their dream catcher. So this was the sleep lesson. I don't know if you can see, but they set a classroom goal to have a earlier bedtime, which they set as 9 o'clock. I found interesting. And then below there's a language or a vocabulary list. So part of this, what's really important about this program is that there are a lot of components that can be adapted to each community. It's not changing the core components of the program, but there are places where they can insert their local knowledge, their language. We give recipe cards, but we also give templates where they can put their own recipes on with foods that are important to the community. So this was really cool to see, and a big shift in really how we're thinking about program delivery. So initially with this project, we had intended and written into our grant to fund 50 families in 2 communities, each for 2 years. So 100 for 2 years. And a combination of community suggested funding strategies. I guess that's mostly where it's come from. We've actually been able to reach quite a bit more. And into a 3rd year even. We were just planning to track those communities and see how they were doing. So one of the things that was unexpected was how many families we were able to reach. And these are families that actually received the materials in the home. Is the numbers on the top, and this is across 7 different communities. But then that set of blue circles, that was completely new and not something that we expected, that the classroom teachers would want this and would want to be implementing it. It is being implemented to a incredibly wide range in terms of, some look at it and think, oh yeah, that's cool. And some are actually, like you could see from that photo, becoming deeply involved. One of the things we learned that was interesting was that that teacher is using it to satisfy Indian education for all requirements. So that's something we're hoping to learn more about how that works for them. So that was really exciting. We reached a lot more than we intended. These are our current partners, and it doesn't look like as many as there are. Like, for example, there's a community in South Dakota where they're receiving 200 kits this year, but I think they're sending it to 4 communities. South Dakota is pretty similar to Montana in that way that everything's pretty spread out. So it's quite an undertaking for them to actually get the program to the schools where they're delivering that. And those are for the in-home program. So these are at a little bit higher level. Within a lot of these are several communities that are participating. And really the reason we've been able to reach so many is because of those partnerships. It's been really hard watching our partners struggle as SNAP Ed programs, have been eliminated. Some people have been moved into other positions, others have not. Every state has been handling that a bit differently. I mentioned we're in 4 states right now. One of the big things related to adoption, especially as we move into this classroom space, is alignment. So understanding how it meets the needs of teachers. Like, this is really exciting to learn that it meets an educational standard for them in terms of the Indian education for all. It also aligns really well with a lot of the Head Start standards. So we've been working a lot to really identify and articulate which standards are being met so that when they see this, they say, oh, great, I can use this in my classroom. It's going to meet these needs for me, and this is a win for everyone. Also have been working to adapt the materials for the classroom. For example, the activities were designed with the family in mind. So it might be a physical activity like a game for, a grown-up and 2 or 3 kids. Maybe there's more, but adapting that to be for a classroom for 15 kids or 20 kids, thinking which components we can provide at scale. The books are really expensive. We can't provide 20 copies of those, unfortunately, but when we send these classroom-only kits, there's quite a few components that we can provide at scale. And the classrooms get a big moo, which is fun. So looking forward on this, and you can see some fun pictures of our partners using this. The kids in the corner, I love this one. One of the books was Yoga Whale. They were doing the yoga movement in the classroom. So a lot of these are classroom based. The handout is one of the communities worked on language lessons for every single Turtle Island Tale lesson. So they took keywords from the lesson and translated into the 3 languages of the tribes there, which was really pretty neat to see. So we're focused a lot on this classroom implementation, trying to understand that and support that, because that was really driven by the community. That was what they wanted, and it seems like that's a really viable way forward, particularly because it's a lot more cost effective. It's about $45 for a classroom kit per month, compared to $35 for a family kit. So it's something like $420, I think, for a family for the year. So that's what a SNAP Ed program would have been covering. So you can reach 20 kids for essentially $10 more per month. So a lot of our focus right now is just understanding, where our partners are, because there's just been this huge shift. It was unfolding beautifully. SNAP Ed was really taking this up and finding ways to fund the program, and I'm just hopeful we can find ways to keep that going. These are some of our videos. If you haven't seen them, they're pretty cool. It's on turtleislandtales.org. They're really good. They're very high quality. IGMU's in them. It's pretty fun. Just want to acknowledge the project team. Okay, what is the actual time? Sorry, I'm not going to try to convert while I'm looking. Okay, we're good. Okay, so I wanted to, well, are there any questions about that? I'll save a little time at the end, but I'm going to switch to talking about 4-day school weeks now. So anyone had a quick question? Okay. So I kind of left this here in terms of kind of my personal journey. Wisconsin was where I met Alex. We've been working on this project pretty much ever since. She was recruited to come here to run care, or to direct care, and I took a faculty position at Oregon State University, which is where I started this 4-day school week work. And what's interesting about this is that my husband's also an academic, and he's a little bit behind me. So when it came time for him to find something at Oregon State, that just proved to be a challenge. They weren't able to find something for him. So because of the relationship I still had with Alex, I reached out to her and, just wanting some thoughts or suggestions on where to go from there. She brought both of us out here. Oops. Gosh, this was back in 2018, I think. I had just become interested in this idea of 4-day school weeks, and I'll talk a little bit more about this. But at the time, there was very few publications on the 4-day school week. I got interested in it thinking about what happens when kids lose access to school meals, and I'll talk more about this. But when I came out here, there was maybe just a handful of papers, and one of them was by a faculty member in Mark Anderson in ag economics, looking at academic achievement in students in Colorado, actually. And I was like, oh, I want to meet with him because there's so few people who are studying this right now. And I sat down to meet with him, and he said, oh yeah, there's actually someone at Oregon State who's studying this. And I thought, that's strange. Like, I don't think anyone's studying this, let alone at the place where I am currently working. But it turns out someone in the economics department was in fact interested in the 4-day school week. So went back to Oregon State and connected with him. And we've been working on the project ever since. So never expected an economist would be one of my closest collaborators, but here we are. And I'm now with PhysNic here at MSU, but I continue to be really involved with care. So that kind of completed my journey. But had it not been for coming out here, I would never have found Paul back at Oregon State and really gotten deeply engaged in this work. So I wanted to just talk a little bit about this project. So really what we're trying to answer through this, kind of thinking about that socio-ecological model, is really what does the school environment provide for children and families? And the way we're asking that question is essentially what happens when you remove access to the school environment in some way. So we know schools are important for lots of reasons. So academics probably come to mind first of all. But as I mentioned, I became interested in this question because of school meals. A lot of kids get school meals. And often more than one. So they might get school breakfast and school lunch. If they're the after school program, they're likely getting fed there as well. We know that there's also physical activity opportunities, so both structured through curricular components like physical education classes or health enhancement, and also recess. But there's other things too. There's the social exposure that kids are getting at school. There's access to health services that's happening in a lot of settings. Some kids get their medications at school. Some are getting dental checkups in the school environment. So we know there's a lot of really important things that are happening. And I think probably all of you we were talking about COVID earlier, can think about what happened when we took some of that away through COVID. That was obviously a very unique situation, but all of the things that schools provided, supervision of children. I think we don't really like to say it that way, but that is a big factor. It allows parents to work while their children are in schools. So what kind of led us to this 4-day school week question really was this interest in obesity in the rural context. So this was work in Oregon. We know that rural populations, so kind of switching populations here, experience a lot of challenges really specific to or unique to rural settings, things like food security, food access, healthcare access. So we were interested just in the experience of elementary school children in rural elementary schools in Oregon. So this was a study of about 1,700 kids where we confirmed high levels of overweight and obesity, higher than their urban counterparts among these elementary school children. That figure on the bottom is looking at minutes of, and this was objectively measured physical activity during the school day, which was really right around 20 minutes of moderate to vigorous physical activity over the entire day. So pretty low. And we didn't measure outside of the school day, but there's lots of evidence suggesting that it is also low outside of the home. And one of the things we found in this was that where households that had high food insecurity also felt less able to provide physical activity opportunities for their kids. So things like organized sports, or thinking about rural communities, it often isn't the case that there's a park next door or down the street. It's a little bit more expansive in some of these communities. And so families do rely on these more structured physical activity opportunities. So we're seeing low physical activity during the school day, and also some kind of rural specific challenges. Often kids are riding the bus for an hour maybe after school. I see some head nodding. So there are specific factors in rural communities that limit families' abilities to provide ample physical activity opportunities. And there was some other research that we were following, so this is all kind of converging on why 4-day school weeks, that looks at what happens to kids over the summer specifically. So looking at, and really just the main takeaway here is that there's lots of research showing differences in health behaviors over the summer. If any of you have kids, you can probably really, or even for you, sometimes it's in the positive direction, maybe more time outside, more time playing, but things like sleep and diet are changing over the summer. And there have been several studies demonstrating weight gain, accelerated weight gain that happens over the summer. So we know there's learning losses that happen over the summer, but also some health losses. So this idea that schools provide moderate protection against obesity risk. So that kind of led us to thinking about the 4-day school week. How does this fit into that? It's not the summer. It's not an extended time away from school, but it's essentially a perpetual 3-day weekend. There's lots of research looking at weekday versus weekend behaviors as well, showing similar things. And again, you can probably relate how late you stay up, what types of foods you might be eating. And so knowing that 4-day school weeks are becoming increasingly popular, we were interested in how all of these factors were coming together. So really what the 4-day school week is a policy response, mainly, previously at least, in response to budgetary challenges. Schools who were faced with decreased budgets, teacher shortages, looked to this policy, and it really actually has a lot to do with state level policy that mandates either days in school or hours in school, that even allows for a 4-day school week to happen. But what we know, and this graph will show this in just a minute, there's been a huge increase over the last 20 years in 4-day school week use, primarily in rural areas. So this, one of the first things we did was to compile a national database of 4-day school week adoption. Who's using it? Where are they using it? How long have they been using it? Which off day do they have? Are they lengthening those other 4 days? In most cases, yes, because they have to meet those minimum hour requirements. So this is just showing the number of districts. These are like 2 or 3 year increments that have adopted 4-day schools over the last 20 years. So it started in about 1999. So you can see it's primarily a Western, half of the country that's adopting this model. Oregon and Montana are 2 of the top 5 states for a number of districts. I will say it's not incredibly high in terms of number of children because these tend to be smaller rural districts. But really, we just wanted to know what happens when you reduce school access by 20%. So understanding this has been taken up rapidly, and so few studies have really looked even at what's happening with kids. I mentioned that one that we knew from here, that there was a handful of studies on academic achievement, some on cost savings, which actually showed they're quite low. You would think maybe they'd save, I don't know, 15%. They're actually saving more like 3 or 4% of their total budget just because of fixed costs and other things like that. This is just showing in Montana. So over time, and you can see the location, it's pretty widely dispersed across the state. But just over time, since 2006, there's been a really big increase in this. How many of you are familiar with this as a concept or know of 4-day school week schools? Okay. Yeah, I think some people have no idea, especially if they're on the East Coast. It's like, what? This is a thing you can do? So with this, we actually flipped that socio-ecological model a little bit. We thought a long time about how to construct this figure. Before it was the child and the family that were in the middle, but because we're so interested in the school and that's where things are changing, we put the school in the middle of this. And it's just a graphic depiction of this, but really thinking of what the school environment provides for families and communities. What happens when you remove one day? Who picks up those differences? Who's watching the children on that 5th day? Who is providing food? Is it the family? Is it a community resource? Are there available services in the community to even pick up those gaps? What we're finding actually is that there are some benefits. When families have that day off of school, they're better able to attend healthcare appointments, for example. A lot of families in rural communities often have to drive 1 or 2 towns over to access even the orthodontist or get a haircut. I mean, there's just various things that this allows them to do while missing fewer days of school. We suspect there's a lot of family level factors that contribute to whether or not a child will benefit from this model. Most of the evidence to date suggests there are detrimental academic outcomes associated with this. They lengthen the other 4 days, but overall they're spending significantly less time in school. And then, like I said, we were interested in the health changes. What are they doing on that 5th day? And how over the course of a school year is that impacting their health over time? So all of these factors are big questions that we have. So we've started to try to pick this apart a little bit. One of the things we looked at really initially was what's happening during the school day. They are lengthening the days, but we found some pretty interesting things. They do have reduced weekly minutes. That's probably not surprising, but what the figure on the right is showing is just that even though total instructional minutes were decreased, they actually in 4-day school weeks offer more minutes of physical education per week. So it's not even like as a total, like relative, like percentage wise, it's an absolute number, more minutes of physical education, more minutes of recess. If any of you have experience in schools, you might understand, this was surprising to us, but in talking to teachers, it's like, well, they can't sit all day. They need to get up and move. So we've added an extra recess period, which is great. So this was nationally in the school and staffing survey, which had a decent representation of, well, actually, it was a little bit low on the 4-day schools. So we were able to look statewide at Oregon in all schools and did confirm that they had higher levels of PE. We were also able to access some objectively measured weight data for first and third graders, and there was no difference between 4 and 5-day schools in that regard. This is using existing data, and there's certainly some limitations to that, and we're really interested to continue exploring that. But the PE part was pretty interesting. There's also now been 2 states. So we looked at adolescents in Oregon. There was a very similar study in Colorado using the Youth Risk Behavior Survey. We're currently analyzing Montana data on this, but essentially it is a self-report survey of adolescents, 8th and 11th grade. They ask a whole host of questions about health behaviors, diet, physical activity, food security, drug use, sexual behavior, all sorts of things. And we did see significant differences. What was kind of interesting is that they reported fewer days of PE, which is true because they only had 4, but they were actually getting more minutes. So thankfully we were able to explore that in a slightly different way. Adolescents in 4-day schools reported being more likely to be food insecure. More drug use. So this is something that's of interest. There's actually some cool studies looking at juvenile crime, showing increases in juvenile crime in districts that have recently adopted a 4-day school week. So it's likely maybe that adolescents are being left unsupervised. There might not be a childcare option for an 8th grader. A family might not be able to afford to care for an 8th grader 1 day a week. And so there might be more unsupervised time, and that could lead to a whole host of things like drug use or just less optimal health behaviors. Maybe they're just on screens all day. And actually, through focus groups, we found some really interesting community level adaptations. Like there was one community that said, well, everyone just brings their kids on Fridays, and that's just the way it is. Like you go get your oil changed and there's a kid there. At the clinic, there's a conference room, there's a whole bunch of kids there. You could probably imagine what they're doing, but at least they're supervised. And so the context of the community really matters. So getting back to that socio-ecological model, and that's really where a lot of our work is right now, is understanding what are the factors in the community, at the community level, that might be supporting kids to be successful under this model. We also looked at food insecurity. And again, this was utilizing existing data. So we weren't collecting this. And we were able to get it down to the district level. And really what I want to point out from here is that we didn't see any differences in 4 days. And so this was nationally. Controlling for all sorts of factors that might be related to food security risk, like rural status, race, ethnicity, adult education level, all of the things you see up there. There was no difference in food security between students or districts, in 4 and 5-day schools. However, we also asked the districts if they did anything to provide food for students on that non-school weekday. Maybe it's sending home 3 days of food in a backpack instead of 2 for backpack programs, or other programs that, opening a food bank or another community resource on that Friday for families. So districts that did provide some service had lower food insecurity compared to 5-day schools. Those that didn't had higher. So that might have been contributing to the fact that we saw no difference. It seemed to depend on whether or not they provided some options for food. And certainly when we compared among 4-day schools, those that did and that didn't, there was a difference where there was less food insecurity when they did have some sort of program. So fairly small differences, but we're really interested in trying to understand how communities can support families in this model. Another thing that we're looking at is how the food environment might relate to that. So some of the factors that I mentioned about rural communities. So, food access. This figure here is showing the food environment index. And the gradient is just showing as it gets darker, the food environment gets bigger. So you can see that 4-day schools represented in the triangles are pretty dispersed throughout those. So I think we can start to ask some questions around that. Are these protective factors if they have a better food environment, for example? And this has to do with food access and other factors that go into that score. So that's another thing we're looking at. But there's a lot of questions that we still have. One of the main things that I really want to understand is how family structures really contribute to whether or not children are successful under this model, and how you even measure success. Some people might say it's academic. Some people might say it's health. Some might say it's some other component of well-being. It might be financial. How a family is structured. Do they have a single adult in the household? Do they have 2 adults that work? Do they have one that can stay home? Do they have an adult with a flexible job? All of these things I think will really strongly relate to whether or not children are successful, however you choose to define that. Again, what's available in the community? How does that support or not support health? Digging deeper into that PE question, like that's really cool. They're offering more PE, but what are they doing? Are they actually being more physically active in PE, or did they just add time to the end? We don't really know. And how that will relate to things like obesity and chronic disease risk. Also, how long they've been on the 4-day school week. There seems to be kind of a small boost, at least for academics, when a school switches to a 4-day school week that then levels off. It might be that schools are offering programs or support on that 5th day that then falls off if participation is low, which is something we've heard from a lot of superintendents. There might be differences based on urban rural status. We don't really know if it's actually working to recruit and retain teachers. That's a question that we have as well too. Especially as more adopt this model, it becomes less of a relative advantage to go to community X over community Y. So they're losing that opportunity. And then we don't really know what they're doing on that 5th day. And I suspect that it varies quite a bit. And really the goal is just to identify any gaps so that down the road, if there is a gap, that maybe we can partner with Extension or other programs to fill any of those needs that might get identified. And I just think this is a cool topic. These are just some headlines from the last year or so. Actually, the one up in the corner was just from this week. Independence School District in Missouri is one of the largest districts and they're a more urban district to have adopted this, and now it's being challenged. So we've seen this huge rapid increase, and I think I don't know if it hasn't slowed down, but there's certainly some pushback. And even here specifically in Montana, I know Elizabeth, you gave me a copy of that newspaper article over there from back in the spring. Some parents sued the school district here in what is it? I forget which district it is. Lawrence Carlton. But this is another one from this year too. So this is a very active policy consideration, and we simply want to urge that health be a consideration when people make these policy decisions. That's our team, and with that, I'm happy to take any questions.